So we got a case review for you today talking about how NUCCA chiropractic care it has helped someone not only once but twice with hearing loss related to a Meniere's disease flare-up. As always, we've gotten patients' permission to share some of this information with you all, and obviously, especially when it comes to something like this with hearing loss, which is complex, results aren't typical. So first, let's talk about the patient. It's a 40-year-old female, and she had basically had a Meniere's disease flare-up causing vertigo and senses of being off balance, but she also had tinnitus and fullness in hearing. She also had hearing loss, and she had heard about how upper cervical chiropractic could benefit some patients with Meniere's disease. And she came into the office and she had recorded her hearing scores with an audiologist, and that's what you could see over here on the left-hand side. So what you see on this graph over here, that is where she's at, and that indicates low frequency hearing loss. And over here, you could see the normal graph. So there's quite a bit of discrepancy between what normal is and how much loss of hearing that she had, which is considered sensory neural hearing loss. So we took care of her after the course of a number of months. She had reported that her hearing had gotten better. She was having less fullness, and overall her ringing was a good bit less. So she had her tests redone, and sure enough, when she got the test done, you could see that those graphs almost superimpose, which basically signify that her hearing had been returned basically to normal. Now, unfortunately, Meniere's acts like an autoimmune disease, and it does have periodic and unpredictable flare-ups. And she did suffer a flare-up earlier this year. She lost her hearing again, and she got it retested, and her hearing had gone back to previous lows that she had experienced when she had her first flare-up. We went through and we were adjusting her the same way that we had adjusted her in the past, but it wasn't really making that much of a difference for her. So what we did was we took a new series of x-rays with her to reassess the biomechanics of her neck to see if anything had changed in her upper cervical spine. We saw that there was a very small and slight change, and we made a corresponding change to her alignment. And after we gave her a new alignment, sure enough, her hearing started to come back and was a little bit better. She got an audiology test again shortly after that new adjustment, and sure enough, her hearing scores had improved. She still has a good amount of very low frequency hearing loss, but it's starting to trend back upward, which matches what her first experience was, and hopefully over the course of a number of months, she'll get it all back again. Now, this doesn't mean that hearing loss is something that is always going to be responsive to upper cervical care, because that's not the case. But some patients with Meniere's disease with audiological type symptoms do tend to respond towards these upper cervical adjustments.